Hi, today I'd like to talk about a very common cause for tubal factor infertility, which is Hydrosalpinx. A lot of patients have Hydrosalpinx. They're recommended to go for IVF, but actually they need to go for treatment first. Otherwise, IVF will be repeatedly failures. Now let's explain why that happens. So Hydrosalpinx, you can see in this diagram that there is a very distinct difference between the two fallopian tubes. One of it is swelling. And this swelling not only causes blockage, but there's an accumulation of fluids inside this, causing it to actually swell like a balloon, expand in volume and size many times. And this usually can be diagnosed using either laparoscopy to actually physically look at the fallopian tube, or we can diagnose it using ultrasound and also a HSG for a fallopian tube. Then only we can actually properly diagnose, because in many cases, Hydrosalpinx doesn't really carry any type of symptoms. The symptoms are very rare, very undependable, and if there are symptoms, usually it's excessive vaginal discharge or mucus, or some abdominal pains, discomfort. These are some of the symptoms that we see. But usually we will rely on these diagnostics to actually confirm your case. So we know that fertilization happens in the fallopian tube. When these types of conditions occur, they will completely stop the process of fertilization. Now, why do I say that before you go for IVF, you need to seek treatment first? It's because the fluids that is accumulating inside this fallopian tube, this swelled fallopian tube, actually will flow backwards into the endometrium, and this is very detrimental because it's actually toxic to the embryo and also the endometrium, causing implantation failures, affecting the early development of the embryo, causing almost an inevitable miscarriage. So you need to have this type of knowledge before you go for your IVF, otherwise you'll be wasting a lot of time and money as well. So treatment here at the hospital is very different from conventional treatment. Conventional treatment is that they will simply recommend you to have the entire fallopian tube removed. It's very invasive. You don't really need to do that when you have a surgical methods to actually preserve the fallopian tube and also retain its function. So if you actually magnify the opening of the fallopian tube, there's actually two layers on the fimbrae, which is why when it's closed, it will start accumulating fluid. So our surgery here, we use 3D laparoscopy to actually fold this top layer back, like as how you will roll up your sleeves. And then we will stitch it on the top layer here. And this will guarantee that it will not close again. Now, a lot of doctors don't know this. That's why they recommend you to remove your fallopian tube, which is very damaging and not necessary. So this way, when we just fold the top layer and stitch it here, it will never close back again, and you can retain the function, you can preserve the fallopian tube. This way, your IVF can be successful, and also there's potential that you don't even need IVF anymore. You can go for natural pregnancy and avoid any pregnancy complications. Now, if you'd like to learn more information, such as treatment for Hydrosalpinx or any other related to infertility or pregnancy or miscarriage, do visit our website at www.antaihospitals.com, or also leave me a comment down below.